World Hypertension Day is observed every year on May 17th. It has been observed for the past 20 years, 2 decades. And the World Hypertension League first started observing World Hypertension Day, and they actually lead the charge in terms of World Hypertension Day. So World Hypertension Day seeks to bring awareness of the problem of hypertension as a condition. And unfortunately, most persons with hypertension, about half of the persons with hypertension, do not know that they actually have it. And so World Hypertension Day is about raising awareness in terms of early detection of hypertension, the importance of controlling hypertension, and avoiding the complications of hypertension. Hypertension is actually the leading preventable cause of premature death in the world. And when we're looking at premature death, we're looking at deaths occurring before persons reach the age of 70. Because hypertension affects many people, and an estimated 1.4 billion persons around the world aged 30 to 79 are affected by hypertension. And in St. Lucia, 2 out of every 5 persons, that is about 40% of persons aged 18 to 69, are affected by hypertension. Uncontrolled hypertension leads to very serious complications and death. We're looking at complications like heart attacks, strokes, kidney disease. And so these complications affect the productivity of persons. They can take the lives of breadwinners, plunge families into poverty. They affect the productivity of the country. They lead to economic losses in terms of our country, a strain on our healthcare sector. And so there are many implications when it comes to hypertension and what it causes. The other problem with hypertension, which is why we need to make sure that we observe hypertension and we make persons aware of the problem of hypertension, is the fact that hypertension is called the silent killer. And the reason why it is actually called the silent killer is many persons with hypertension will not feel any symptoms. So many times persons say, oh, well, if I have high blood pressure, I'd feel it. My neck would hurt. My head would hurt. That is not true. Most persons with hypertension don't have any symptoms until, it's too late with the chest pain, with a heart attack or something. And so we want persons to be able to measure their blood pressures routinely so they know whether or not they are hypertensive. And of course, if they know whether or not they have high blood pressure, they can do something about it. But if they don't know, which is one of the problems, they can't do anything about it. And many times, it is too late or the complications have already happened. So one of the problems is the fact that hypertension is about numbers, and if we don't know our numbers, we don't know that we have high blood pressure. So persons are not doing what we call early detection. They're not measuring their blood pressure, so they literally don't know. So the statistics state that about half of persons with high blood pressure do not actually even know they have it. So if they don't know they have it, they can't do anything about it, which would be one of the reasons why persons would die, because they don't know. The other reason is that persons, the control of high blood pressure is not optimal. So worldwide, under 25% of persons who know they have high blood pressure are actually controlled. And uncontrolled hypertension or high blood pressure has, causes of complications, strokes, heart attacks, kidney failure, and so on. One of the other reasons is that persons with high blood pressure many times they may have problems taking the medicines. So for high blood pressure, our treatment consists of lifestyle practices, a healthy diet, physical activity, avoiding toxic substances, lowering stress, those kinds of lifestyle changes, as well in many instances, taking medicines which are proven to work and proven to actually control the high blood pressure. Many persons are uncomfortable about taking medicines. Some persons feel that the medicines may do damage to them. In our setting, in St. Lucia especially, persons may take alternative treatments, they may take things, but not measure their blood pressure, so they actually don't know if those other treatments are working. So I think there are various reasons. Sometimes persons are not educated in terms of the complications of hypertension. They're not aware of what the repercussions are, and so they take the whole fact that they have hypertension lightly. So one of the very important things is, as the theme suggests this year, controlling hypertension together, there is the aspect of personal responsibility. We can make healthcare available, but if persons aren't coming and receiving that healthcare, it can't help them. Persons need to be in a position where they make checking their blood pressures a priority. You can't address something that you're not aware of. So persons need to actually do detection or measure their blood pressures. If an individual is hypertensive, he or she needs to know what the target blood pressure readings are to know when they're controlled. He or she also needs to be able to do those things which need to be done to control the blood pressure, which would be the lifestyle changes, taking the medicines consistently. And that's one of those things that again, personal responsibility. Medicines for hypertension or high blood pressure need to be taken consistently to keep the blood pressures optimal. Physical activity actually helps lower blood pressure. Okay, the recommended physical activity for adults is 30 minutes of moderate physical activity, 5 days a week, or 150 minutes a week. Healthy foods, especially foods low in sodium. All right, sodium is one of those things that pushes up our blood pressure. And foods that are high in fiber, fruit, vegetables, non-processed foods. Processed foods tend to be very high in sodium. And so persons who want to prevent high blood pressure or persons who already have high blood pressure should really be careful about the kinds of foods they're eating. We're looking at trying to eat foods as natural as possible, without all of the additives, without eating at processed food. So we're looking at healthier food options, low sodium, avoiding all those fatty foods and that kind of thing. So we're looking at a healthy diet. We're looking at physical activity, which actually reduces the blood pressure levels. But for lots of us, just doing lifestyle changes may not be enough. And so there is a need for medicines which are proven to be effective to lower blood pressure as well. Being consistent about lifestyle, the positive lifestyle practices actually helps persons need less medicine. But for a lot of us, especially because of our ethnicity and so on, high blood pressure can, in our setting, be difficult to treat with just diet and exercise. At every wellness center across the country, Persons can actually come. They have access to free blood pressure checks. They can check their weights, right? Their what we call their body mass index. They have access to see the nutritionist who can guide them in terms of what to eat. They have access to the district medical officers or medical visits. We also have an internist who is especially trained to treat persons who may have hypertension that's difficult to control. We have antihypertensive drugs, right, or medicines, which are free of cost should they be needing those at every wellness center. And so we have many outreach services. So the Ministry of Health, we cater to the needs of workplaces. So our nurses and our health educators actually go out into business places, communities, and they do what we call free screening, free health education. So if persons need to know where they are in terms of blood pressure measurements, and so they have many places that they can actually go to. And they're free to walk into any wellness center, which is, we have 34 wellness centers, which are across the country, close to everybody in St. Lucia. I think what I want the public to be aware of is that high blood pressure does not have to end our life. It does not have to limit us. High blood pressure can be controlled if detected early, if monitored regularly. So persons with high blood pressure should be monitoring the blood pressure values regularly at home, which is what we call self-monitoring, but also with the healthcare provider. There is a team of healthcare providers in our wellness centers, in the public sector, as well in the private sector. And persons can actually have that support in terms of managing high blood pressure to avoid the complications and live as normal a life as possible. But again, we're saying that when it comes to high blood pressure, to be able to control high blood pressure, it needs to be everybody together. And there is also the very big aspect, and I cannot reinforce that enough, that there needs to be personal responsibility. We need to know what our numbers are. We need to know what our blood pressures are. We need to know what readings are normal. And as we measure our blood pressures, as we monitor, we are able to see, okay, well, this works, okay, or that doesn't work. And so we're able to actually be part of the process of managing blood pressure.